Hi Jay, welcome back to the Right Care Clinic.
Yeah, thanks for having me.
Glad to have you back. How are you doing?
I'm doing good.
Good. Have you noticed any difference in your speech since you've been here?
No, I feel like it's about the same as it was.
Great. Well, we just want to go over the assessment and some of your strengths and weaknesses, and if you have any questions, please feel free to let me know.
Okay.
So just quickly, looking at your hearing status and your language sample, your hearing was great in both ears, so no concern there. And your language skills looked really great too, so also no concerns there. Looking at the stuttering severity index, we administered to measure characteristics of your disfluencies. It looks at frequency of stuttering, so percent syllables stuttered on the syllables that you say, average length of the longest stuttering events, and physical concomitants, so maybe facial grimaces, eye winks, head nods, stuff like that. What we found is that the two passages we had you do, one oral reading, reading that passage we gave you, and then in a spontaneous speech sample, was that the percent you stuttered on syllables in your oral reading was 0.89, which was less than your spontaneous speech, which was 13.7% of syllables you stuttered on. Is that pretty usual for your speech, would you say?
That seems like it represents what.
Reading's easier than just speaking.
Yeah, I definitely think that reading a word is easier than. I feel like I avoid words more when I'm like just trying to talk to like a friend or something.
Great, and that's what we saw too, which is normal. So nothing to worry about. When those two scores are ranked, the oral reading is, you can see it's at the lower end, so less severe, and the spontaneous speech sample gets a little higher up back into the more severe range. Like you said, I think a lot of your those scores were up at 13.7% is because there was a lot of pausing and hesitations, and you mentioned that it's because you are trying to think of words or sounds that you avoid and maybe make some revisions around them. So I think it said your average length of stuttering event was 3.18 seconds. So like I said, just long pausing, which can take away from the speech naturalness of your speech. So physical concomitants, there wasn't too many. Distracting sounds, none. Facial grimaces, not very many at all. Head movements and moving of extremities wasn't noticeable either. So overall, this places your stuttering at the mild range compared to others who stutter. Everything makes sense so far?
Yeah.
Okay, any questions?
Nope.
Okay, great. So with that being said, we would still love to see you for some therapy. What we are going to recommend for therapy is targets for fluency of speech and just some overall counseling and education. So some fluency things we could give you are improving speech naturalness, so less pauses, less revisions, reducing the number of stuttering events, reducing avoidance of feared sounds. You had mentioned that you avoid vowels a lot. Yeah. Because you stutter on those.
Certain sounds.
And improving communication skills in various settings. I know you're busy with work and school and home and friends, so just feeling like you can get out in these environments and not have to feel so scared by these stuttering events.
Yeah, I would say a lot of my avoidance is because I have anxiety about stuttering. I'd rather do anything to avoid stuttering.
Yes, and you mentioned it even takes away from raising your hand and asking a question in class.
Yeah.
So that's great to know, and we can definitely give you some strategies and tools to help with that. And just increasing overall knowledge about fluency disorders. I know you had mentioned that you were interested in finding out what causes stuttering and what may have caused it in your history. So I can tell you it's a lot of factors. It's usually not just one. It can be environmental, it can be developmental. So I know you had said you had taken a hit to the head in football. Could certainly be that. You have a family history, it could be that too. So a couple of different things. I have some resources to give you also that might help with some education. Awesome. We also want to make sure that you are touching base with a primary care physician. Did you happen to find one in Missoula?
I haven't done that yet.
Okay.
But
we do have some names we could give you.
Okay.
Also. We just want to make sure that you have a doctor, to monitor your medication schedule.
Okay.
So, managing those medications can help with fluency.
Okay.
So, here are some of the resources you can look up until we start treatment. One is stutteringhelp.org, which is a great website for just talking about stuttering causes, like you said. Gives you some strategies you can use at home to start practicing. And then the website